In the heart of Guadalajara, where the vibrant streets echo with laughter and life, there lies a silent epidemic that ravages the innocence of childhood. Burns. In homes filled with love and warmth, tragedy strikes unexpectedly, leaving behind scars both physical and emotional. Whether it's the sizzle of oil on a neglected stove, the hiss of a curling iron left unattended, or the crackle of fireworks illuminating the night. Each sound serves as a stark reminder of the dangers that lurk in everyday lives of our children. But amongst the darkness, there is hope. Through the tireless efforts of those that make up the Morales Foundation, these children have an opportunity to regain that piece of their lives the searing heat took, regain function, movement, and confidence from terrible scarring, to be normal again. For in the ashes of despair, there lies a flicker of hope for children who would otherwise be forgotten.
All right, we're now at the gate, and plane's right over there, and we're on our way to Guadalajara. So the whole team's almost here. We're waiting for, I think, Satari now. We're gonna be hanging out for like maybe an hour before we load up, and excited. We got have a whole suitcase crammed full with supplies for surgery. I have instruments this year. I have better supplies. I have suture material this year. I have everything for the kids. Like I had a little bit extra stuff for the kids as well. And so, we came fully prepared, even more so than last year. So, so excited. My mom's here. My mom turned 70 a couple months ago, and so it's really important for me for her to see like what I'm doing and what we're doing and the impact we're gonna have, and the legacy that is built off my dad's career. So anyway, here we go.
The Morales Foundation team departed Houston early in the evening, arriving in Guadalajara later that night. Nestled in the heart of Jalisco, Guadalajara is a vibrant blend of history and modernity. Its warm night air hinting at the promise of new opportunities ahead.
All right, we're here. We are in Guadalajara. We are gonna get the day started. We got a big day today. We're gonna go see the kids, do pre-op, see the new facility. Team is ready to go. And everybody got a great breakfast, an amazing breakfast. And here's the team. We got Satari. Say hi, Satari. There's Miss Chris. There's Claudia. There's Miss Rachel. That's Mama Morales. Say hi. Miss Anastasia. And my man Michael Sergio.
Team, let's go. This is the day, big day today.
Ready, Michael?
Yes. Yes, sir. Yes, sir. Let's go, Morales team today. Gonna do good work at the clinic today to help those kids. Let's go, team.
The Morales team drove through the familiar streets of Guadalajara, but their journey led them beyond the city to an unfamiliar destination, promising new discoveries ahead.
It was a little bit different this year. Last year we were in one of the hospital settings that Dr. Miranda's team worked out of. This year, for the past like 2 or 3 years, they've been rebuilding a new facility at one of the oldest hospital institutions there in Guadalajara. And whole new unit. So he had a new burn unit, he had operating rooms, he had a surgical bed, he had surgical ICU. And so it was a different environment for us this year, and it's been really exciting to finally see it in person. He shared videos and pictures of it with me, but it was really definitely gonna be a different experience than we had last year.
This year, we are lucky enough to be at the new burn unit built in Hospital Civil, a unit that for many years now, the dream of Dr. Ariel Miranda. This unit that was just built about a month ago.
It's a waiting room outside. This facility was a lot different because he had researched a lot of burn facilities and burn units across the world. He's well connected, and he's toured multiple facilities all over the world and trying to make his facility the most efficient and the highest standard of care for his kids that he'd be taking care of. And these are just pediatric patients. So
Bienvenidos. ¿Cómo estás? Bien, gracias. Michael, Sergi. Welcome home. Welcome. This is the waiting room for the clinic, and we have a lot of people working here now, and a lot of work. Good, okay? Remember that our theme is recovering stars. All the units have stars everywhere. I'm gonna tell you why. Okay, let's go. Let's make a tour first.
He kind of toured the facility with us. He kind of showed all the innovations of technology in the facility, the patient flow, the way the clinical design. I mean, he met with all the architects, and so they really did a great job in designing the new facility.
And the meaning of the mural, I start into the machine, okay, without bright. You started without bright, okay, and then the machine have aptitude, happiness, compromise, commitment, heart, and all the teamwork is working together. And then we begin to give bright to our stars. Now the stars are ready. And then ¿cómo dijiste, Rachel? The ladder, it begins here. Okay?
That's cool. Just the meaning of the whole mural. Pretty cool stuff.
And this little boy looking the stars, and he makes el casco, the helmet with carton, paper. Yeah. And it's beautiful, I think.
As I got to know Dr. Miranda more, I just really appreciate his love for his patients. He's got a bigger heart than me, I'll give him that one. He really loves his kids. And he's also an artist. He's a plastic surgeon, so naturally he's an artist. And he loves art. He paints also. So he had this vision of having, art within the facility, and to inspire, courage and bravery, and you can shoot for the stars. And so there was this pediatric kind of star theme all over the facility with the artwork and the murals, and just the entire theme was just a beautiful theme for kids who've had these burn injuries and can see past it and eventually become what they want to become. It was very inspiring.
It's amazing. I mean, you can see the love he has for patients and everything. It's just so inspiring.
8 beds here, 8. And this is the OR. The main one is on the end, at the end, but we have another 2. Okay. For shower room, under anesthesia, and another little for a small procedure.
And this is recovery?
Recovery, 3 beds.
And your track, I can see your track.
Yeah. It's a lift to take the patients into the ORs without pain.
Dr. Miranda told me about the facility probably about last year actually. He was telling me what he was building, and he told me that the facility had 1,800 beds. This is one of the oldest hospital institutions in the entire country. And he said his new facility would be, one of the wings of the older buildings of that old hospital. And we got to he took us on the tour of the whole hospital, which was really fascinating, because you saw the old architecture of really hundreds of years old. It seemed like hundreds of years old to me, but it had beautiful old arches, and they had murals up on the ceiling, murals on the walls. And they were reconstruction and renovating the whole complex, so you had a little bit of new with the old. They had old courtyards, they had beautiful gardens. I mean, it was really just kind of a refreshing thing to see in a different country, and how they take care of the patients in their hospital, the facilities itself.
Within these walls, tradition and innovation converge. Dr. Miranda's vision had created more than a hospital. It's a sanctuary where the latest medical advancements meet unwavering compassion. Here, every patient is met with expertise, dignity, and the promise of healing.
So this is the friar who kind of built all this, all the hospitals and the churches, but he was kind of the founder of this whole university complex.
University, hospital.
Was he a priest?
He was a friar.
He was 72 when he came here.
Let's take a picture. A new team member was my mom, and she just turned 70 in February, and she kind of knew what I was doing with my mission trip, and she kind of has a brief overview of what I'm doing and why I'm doing it. But I really felt that as she gets older, I just wanted to make sure she got to experience this mission trip and what I'm doing and why I do it and what inspired me to do it. How I'm honoring Dad, and that just really, really meant a lot for me for her to be here this time.
He was present when he first formed the foundation. My husband got to see that his son was going to do this in honor of him. My husband always told him he was proud of him. And he knew what he was going to do. And I know he's watching over him.
I hope that she'll continue to help me within the foundation and expand the foundation. We established a new relationship in Aguascalientes, raising burn awareness for children specifically, and she's going to be an integral part of that. And to see her excited about it and passionate about it, it means the world to me. So I'm just so happy, and I know he's up there looking down and just so proud of us. And just running around, I definitely kind of felt his presence many times throughout our experience there.
All right, so we're about to see the patients here in a few minutes, and all the patients come in with different needs, whether it's like burn scar contractures or traumatic injuries or. Hola. Siéntese por favor.
Asleen, oh my God, the most precious little 3-year-old that we got to do today. I recalled her from last year, and she was so frightful. She was just so scared of everything. I remember her big curls and how frightened she was about going into surgery and not knowing who or what we were going to do to her. And poor thing burnt herself with an iron at 2 years old. She had capsular contracture, and we were able to release some of the bands last year. But this year she came in and she was so brave. She knew what she was going to get into. She was comfortable with us. The Morales Foundation, she knew our faces from last year, and she was so brave. She was so calm, so unlike last year. So I was really happy to be back with the same patient as we were last year.
Tu mano está más grande.
Con la pierna. Sí, la agarro.
¿Cuántos años tiene?
3.
She was a baby. Remember how small she was?
Yeah, they showed us.
Baby girl grew up, and so she grew up a lot bigger. It's just so good to see her again, and the releases that we did seemed to work really well. Her hand definitely got bigger. Then she kind of revealed that she was having now more of a kind of a contracture of her burn injuries along her first web space, which is between her thumb and her hand. And so that's the crucial web space we need as human beings to manipulate, fine motor skills and also function in our hands.
Surya mañana.
Nos vemos mañana. Sí, está bien.
Buenos días. Mucho gusto. ¿Cómo te llamas? No. Bueno.
So Leonardo is our oldest child. He was burned when he was 1 with cooking oil, stuck both hands in. His mom says that both hands were burned.
One hand, unfortunately, had a little bit more burn depth, so he had a little bit more scar thickening. And so he had a little bit of a functional issue associated to his second and third fingers.
He initially had 2 grafts when he was 5 years old. He doesn't remember the actual accident, but he does remember his first surgery, being scared that he wouldn't wake up from surgery.
Yeah.
So here he developed that deformity because there's slippage there. So it was more deep.
Yeah.
Right? Mm-hmm. The burn was deeper apparently there.
See, the fingers are such a delicate structure.
Yeah, exactly.
There's so many fine
ligaments and pulleys and cartilage slips that once they get off,
Dealing with a lot.
you're dealing with a lot, and it's all because of the deep structures underneath. And so
And the spaces
what
in
you see on the
between,
surface
so it
is
goes-
really just a taste of what's really the problem is. Yeah.
Buenos días.
Hola, amigo. ¿Cómo estás?
Gusto, señora.
Young man was Alonso, and he's also a repeat customer. And we did some scar releases of his foot, and we got to see that again. I had a follow up, and he's a really good functional release. Scar contracture, the scar skin graft looks fantastic. He's able to play football, which is one of the favorite sports. He's still running around. So as right now, as he's growing, he's not having any issues functionally from that reconstruction.
This year we did a revision to the right thigh. His mom states that he feels ashamed because the neighbors actually question all the time, like what is that scar from, or like some kids, kids make fun of other kids, and of course that makes him feel not secure of himself.
We could easily correct that for him and hopefully give him a little more self-confidence and kind of get the teasing and bullying off of him, so he can enjoy life and be a kid.
Victor, he's an 8-year-old that was burnt by fireworks, pretty much from here all the way up to like his jawline, and he was one of the more intensive cases that we had today. He had problems being able to keep his mouth shut because he would have to consciously think about keeping his mouth closed. So when he sleeps, he would snore, have his mouth open, so he would end up having a sore throat.
And he was a very charismatic young man, and he had sustained a pretty significant burn injury to the upper chest and to his neck, and so he probably had the most significant scar contracture deformity of all the children we saw that day for pre-op.
It's just the neck is so mobile that it contracts the skin. That's why the skin contracts, and because it's trying not to be stretched, and so they'll overcompensate by getting these contractures. And so what's going to happen as he grows older, his mouth is going to go like this, and he won't be able to open his mouth.
It didn't look like it was getting him down, but for sure, I know it was limiting his function in his day-to-day life. And so the procedures we wanted to do was scar contractures to release his neck extension, that way he can actually look up, and then obviously be able to close his mouth and not have that contracture affect him anymore.
Ahí vamos. ¿Te ayudo? Sigue haciéndome renegar.
Él ya está bien desesperado.
Yo.
I was actually really moved by Fatima and her story, because she came in today with her mom. They had a route about 2.5 hours away to get to the hospital, and her mom actually, she had just lost her dad like a little over a month ago. So they're currently in a really vulnerable place in their life. So them being able to come here today for her daughter to have this procedure was very touching and very moving for them. When we spoke with the mom, she was just saying, my daughter actually is the one that lately has been keeping me calm. She gives me strength. And, when you would think the little girl being in her situation would be the vulnerable one.
She came in with injuries to kind of her arm, and she had a little bit of a contracture at her wrist, and it's kind of limited some of her wrist function as far as how she could hyperextend. And again, she's a young lady. We knew she was going to get bigger, and it was just only going to get worse.
She was really little. I think she was like still crawling at the time when the injury occurred, where she kind of got into where they had just boiled water to be able to shower. And she kind of heard like something knock over, and she heard like people in her family screaming. She didn't know what happened. And she thought the little girl had just kind of fallen and like bumped her head or something. And it turns out the boiling water had fallen on her.
We're pretty much the end of the day. We had a great pre-op clinic. We saw a bunch of kids and some families. Met the residents. We got 5 residents working with us tomorrow in surgery. So go ahead. So we We're doing some teaching tomorrow, and hopefully they got some education today, because we had some patients we didn't want to do surgery on today. We're going to see them hopefully next year, and as the kids continue to grow. And that's one thing I enjoy for, taking care of kids, because you take care of them over years. You don't really have to do something immediately. As they grow, they continue to get bigger. Things will change. Their scar contractures change, and so we'll address those as they grow. But not some of them we just didn't want to do surgery on today. And it's better just to let them enjoy life, and then when they need us, we come into play. Anyway, I just really enjoyed it. We're gonna go have some lunch right now. We're gonna take the team out for some food, and then we got some planning to get ready for tomorrow. We got some post-operative bags. We're gonna get ready for the kids. I got supplies. I've got instruments for the surgery I'm gonna be doing tomorrow. I'm bringing all those myself. Thanks to you guys who support the foundation, I was able to get a bunch of medical supplies and instruments for this year. Now that I've been there last year, now I know what I need, and we can do a better job and help the patients and families better. So anyway, we're excited. It's going to be a wonderful evening tonight. This evening we're going to be doing a fundraiser with art. So there's going to be an art gallery, and there's going to be taking donations for art. And the foundation this year is going to be very proud to sponsor some art pieces, and hopefully it'll be in the new wing of the burn unit. So we're looking forward to seeing these pieces in person, and kind of got some picked out already, but these are going to be from the Morales Foundation, and these are going to be up in the wing for, hopefully for another 200 years. So. Y'all see the painting that we're looking at? That one? We're gonna find a art piece to donate to the new facility from the Morales Foundation. So we're trying to find something special.
Check this out, man. This is like, it's a little disturbing.
It reminds us of Houston just because it has like a rocket ship, Houston's a space city. So we want them to have a small part of us on their floor.
2 million.
Pesos.
All right, so we're at a auction for art benefiting the burn clinic. That's Dr. Miranda's, and we bought 3 pieces. We got 2 pieces that we'll donate to its clinic, and it kind of goes along the spirit of all the children and the whole theme of the whole clinic. So I'm really excited to donate those to the clinic. And then I also got a separate piece that he painted himself. He's an artist himself, and I think it's beautiful. I love the blues. I love just the style of it. So I'm gonna take that one home for me. So anyway, it's been a great night. We're looking forward to a great day of surgery tomorrow with the kids. And the residents and the surgeons. So we have a night ahead of us just to get some rest and get started for tomorrow.
In Guadalajara, Dr. Morales and the foundation team prepared to transform 5 children's lives. Scarred by fire, their movements once limited. Today, they regain function and hope. Skilled hands restore what was lost, turning pain into possibility. 5 surgeries, 5 new beginnings. Proof that compassion and expertise can change destinies.
It's been an inspiration to see the legacy of my husband manifest itself in reality through my son's skills, and not only in his hands, but from his heart, and to have such a fantastic team that makes it happen, and I'm really, really proud of him.
The 2024 team was different than last year's team. My first year's team, I took 2 of my aesthetic fellows, and I really enjoyed that, and I enjoyed giving them that experience of being on a mission trip. I think it's something I never had a chance when I was in residency, and I think for me, it was very rewarding. And to kind of give that opportunity to my fellows and hopefully inspire them one day to kind of do something similar and be able to give back and use their talents and use their resources to do the same thing to give back to the community. That was very special to me. But this year's a little bit different. I knew going into it with Dr. Miranda's new facility that he had a little bit more limited facility usage of the operating room. And so I was for sure going to have one operating room. Last year I had 3. And this year we had a little bit less, and so I kind of decided to downsize my team a little bit. I really, last year I had residents alongside our fellows, and I didn't quite fully appreciate and the experience of mentorship with those residents. And this year I wanted to be a little bit different. My fellows are late in their career of education, and they know what they're going to be. They're going to be aesthetic surgeons. But his residents are very early in their reconstructive plastic surgery training, and to have impact on them and hopefully inspire them to be able to take care of patients and do the complex procedures that they perform in reconstructive surgery, specifically in burn care. I really wanted to kind of focus on them this year. So that was my focus. Is I was going to be the faculty, and I was going to help them with the procedures. I would help with the planning and the guidance, and then we would be able to let them operate. And so this year I was able to get actually two rooms this year, and we're able to kind of go a little bit more efficiently, but having the residents do the procedures for me alongside them was very rewarding this year.
We are doing the first case with the scar release of the web space. She can't open her thumb completely, so we're going to release that scar contracture and just move some little skin flaps so she'll be able to open it fully. So we're getting, she's been gassed down, the baby's been gassed down to kind of relax her, and then we're going to get some local anesthesia in the skin, and then we'll get the procedure started. So it's really like maybe a 15-20 minute procedure.
You need a mask.
We basically rearrange skin to keep it as simple as possible. We rearrange skin to release and give her more function of her first web space. And so that procedure was a pretty much straightforward procedure, but the concepts that are involved with that is really you have so many different options of these, they're called skin flaps, of rearranging them. And then for the what I try to focus on my residents is less is more. I'm a big proponent of less is more sometimes. You don't need to use all these complex flaps and all these aggressive techniques. If you don't need it, you don't need to do it. And so that was one of my focuses with all the residents, just sometimes less is more. Let's go for simple, get the job done, and then get out. And so that's what we were able to do with her. Is we designed a very simple scar release. We performed that scar release. You could immediately see the amount of release we had from a very, very simple flap, which is, I think that it surprised them a little bit. And then we were able to do the reconstruction, and the skin was healthy. It was not overly traumatized.
It's really common. I mean, we take for granted that we don't have to boil hot water to take a shower. We don't have to, we're not in charge in the kitchen at that young of an age to help our parents fry whatever it is in the kitchen or boil hot water just to bathe in. The things we take for granted, in the States.
¿Usted siente que esto le va a mejorar su calidad de vida a la niña en un futuro? ¿Sí? Sí. ¿Se siente emocionada? Sí. Sí, es expectado, ¿verdad?
No le vaya a remover la venda al día de hoy, no. ¿Okay? Hasta mañana ya cuando venga revisión le vamos a remover todo y le enseñamos cómo volver a poner todo, ¿okay?
That case went beautifully well. We finished it probably less than 35 minutes, which is great for kids because you really want to minimize the amount of general anesthesia you have for the children. That way they have less complications and they don't feel as bad after surgery. So that surgery went great, and I think she's going on to a very quick recovery.
¿Usted sabía que venía el doctor Morales con su fundación a ayudar con su cirugía para Alonso hoy?
No, no sabía.
¿Se dio
del
cuenta
año pasado tampoco.
Okay.
El del año pasado sí nos tomaban de sorpresa, sí, yo dije, ya cuando me dijeron, van a hacerle cirugía a ellos, y yo dije, no. No sabía yo de ellos.
¿Cómo se sintió sabiendo que iba a venir una fundación desde Houston a ayudar con la cirugía de su hijo?
No, pues bien feliz, contenta, porque dije, no, ya.
He had a burn scar that was pretty thick and ugly, and again, the designs of these reconstructive procedures comes down to identifying what the issue is, trying to minimize cosmetic deformities, but also get a functional correction. And so, again, those are teaching involved with the residents, and let's keep it simple. Don't go over, you don't get too aggressive. Keep it simple, and we get a nice, good closure of multiple layers of the skin and the soft tissue. That way we get a thinner scar.
Oh, that's going to boost his self-confidence. Such a positive outcome for him, because, you know, he'll be able to just walk around the neighborhood without people even questioning what happened to him, or constantly being reminded of that scar being there.
All right, so today we operated on Victor. When this all happened, you know, he was 6 years old, and he was in the hospital for like a month and a half, you know, getting the care that he needs, and that was difficult for their family to be away from their home that's 4 hours away, and they came over here. So luckily they have family that they're able to stay with.
Susana, está marcando el nombre de Susana. Pues culpable, por más que nada porque pues en un segundo, porque yo en ese momento no estaba ahí con él, estaba mis papás y mi hermano y mi cuñada. Yo estaba con mi niña, como tengo una niña más chiquita. Sí. Estaba con ella, ajá. Entonces cuando yo salí yo ya lo vi así, entonces es como de que qué pasó así.
I know that we're able to help him today because he's very self-conscious, because people look at him, he can feel that they're looking at him wondering, you know, how did this happen to this little kid? And I know we're going to have to follow him, you know, over the course of his life. As he gets bigger, he's going to need more surgery, and it's going to be a blessing to see how we're able to help.
De primero sí le afectaba mucho porque fue un cambio muy grande pues para todos. Sí. Pero ya después él tomó terapia y pues con la ayuda de la familia y todo, pues ya como que él superó mucho. Sí. Entonces ya cuando le hablaron de una posibilidad segura, de una cirugía para que él mejorara eso, él sí quiso, o sea, sí. De hecho no anda animado, o sea, está contento.
Sí, se ve muy feliz, no tiene miedo, no. Se ve muy bien.
But make sure the chin is sitting on it.
Okay.
Right? So make it, if it's too fat, take a layer off.
Okay.
All right.
And so teaching the residents, again, like, where do we design these flaps? You know, how big do they need to be? Where do you put them along the scar contracture band? You know, in the position, like, and then we had backup flaps in case, you know, the releases that we did weren't sufficient. If we need a little bit more, then we had designed other flaps in case that happened. So there's definitely some thinking of how to do these things. These are, you know, if you're a plastic surgeon, you're like, oh, those just a Z-plasty, but really, it takes more than that. You need to know where to put it. That's a really, really important concept. And so I think, you know, while the residents are during their burn reconstructive training, you know, hopefully give them that skill set and identification of seeing where we can put the releases is very, very important. But the releases came out great. We had great extension with just the 2 releases that we did, which meant that we didn't have to do the other releases. We had prepared for it if needed.
Es un error, un accidente que a mí me costó también aceptar, pues lo que yo, mi parte, mi culpa, eso, ya lo superé, siento. Y pues ya, y verle para que él esté bien, o sea, seguir más que nada, pues haciendo esto, de traerlo a sus consultas y todo. Le digo, yo no quiero que verte perfecto, yo sé que siempre vas a tener tu cicatriz ahí.
Entonces quedamos que el memo era el enamorado.
We're doing hand surgery. Try to sanguinate the blood so it has less bleeding, because the hand is so vascular and it bleeds a lot. So what we do is we're going to squeeze the blood out. And we wrap it with a really tight wrap, squeeze all the blood out so your hands turn kind of white. You can't see things when everything's bleeding, everything's red. So definitely helps with the procedure. And then we mark the time. We're very, very consistent with the time. You don't want to have to do it too long. You don't want to have your hand basically strangulated for too much time, and we'll release it. So we do it like every 30 minutes at the most.
Being an older young man, you know, he's able to tolerate some discomfort, but we're able to do his procedure on local anesthetic, which is fantastic for him. So we just injected a local anesthetic to provide a nerve block, so he didn't feel anything. So it's kind of funny to see him kind of peek up and look down and watch what we're doing during the procedure.
He wasn't able to fully contract his index finger on his left hand. Whenever he would grip, it wouldn't grip all the way. And we noticed this at pre-op whenever they were doing his consult. One of the surgeons made him squeeze his finger and he couldn't fully close it. So we did get to see that and how that affected him.
But again, it was come down to functional releases with skin flaps. We strategically placed them in certain areas of the finger to kind of make sure we limited function. We didn't limit function, but optimize the full release. And so he did great. I just really enjoyed kind of talking to him every once in a while during the procedure. Him just kind of just checking in on how things are going. But his surgery went great as well, and we got him into the recovery unit as quickly as possible.
Él es usted ya. Así es como su hijo es usted, ¿verdad? Sí. Mira.
And she's a nurse practitioner of like 20 plus years. She loves patients, and she just kind of fit right in perfectly. And so she was the one that was able to kind of to connect with the family members and the parents. And so the family really loved her. They felt her nurturing love and how much she cared. But it really meant a lot for me for her to be there and actually see me in action and see how I take care of my patients and how I run my team. And I was just so happy to have her there. She did a great job, and I'm going to have her back every year as long as she'll let me bring her.
Nada que ha pasado es en vano.
Sí. Sí, siempre.
Dios tiene una razón por qué pasó lo que pasó.
Sí, mi tía siempre me dice todo tiene un porqué.
¿Verdad?
Siempre
Es cierto.
tiene, o sea, pasó esto y por qué. Te pasó esto y por qué. O sea, siempre algo. Siempre me pasó en cualquier incidente.
Sí.
¿Por qué?
Her saying, my daughter's the one that's always like, Mom, it's going to be fine. Like, I'm going to be okay. And everything's going to be okay. It just gives her a lot of peace.
We were able to design this the scar release because she had great skin around it, and so she had a very good function for I would say probably through childhood, as her arm and her hand continues to grow with a very likely chance of her not needing another procedure for release.
Her mom did say that towards the end of the day, after her daughter was like very active throughout the day, she feels discomfort in her arm, some pain in her arm, versus like at the beginning of the day after she's rested, she doesn't feel it as much. But that to her was a sign, like, I think she needs to have this treatment, this procedure to help her.
Just so proud of her. She did great in the procedure as well. She was also another young lady we were able to do the release fairly quickly and get her in the recovery unit within an hour. Our post-op clinic went great. To me, you're doing your job well whenever your patients are smiling when they walk in. And the kids all came with like a little bit of a grin. I think they were more embarrassed than anything, but they all had great nights. They had minimal discomfort. This year I was able to provide some Tylenol from the baby to the older young man, so they were able to have their pain well controlled. But then none of them really complained about pain. But to see the moms there and just happy, and you could tell how grateful they were for us to be doing what we're doing. Grateful for the bags that we had. We had post-operative supplies within the bags. We had the ointments and the dressings and the gauze, and we had little toys for them. And so it's really good that they appreciated it, and the residents able to kind of instruct the patients on what we did, why we did it, how to take care of it, the dressings. Claudia came in and helped them instruct with the dressing care after the procedure. But it just feels really good to see the kids so happy and doing so well so quickly. And we look forward to them to continue to recover well. And obviously we'll continue to kind of follow up on the children as they recover for the next 3 or 4 months.
It was good. I mean, he's almost like this now. So he had a huge release of his neck. So he will be able to sleep with his mouth closed, which I was watching him, he was keeping his mouth closed the whole time. And that was different than last time we first met him. So that was a good one.
The team has done an exceptional job bringing in the families.
Gracias. Gracias. Gracias.
Listening to their stories and hearing the obstacles these children have to go through every day in their lives.
I know I've been perhaps not with a child, but through my husband, to see a loved one suffer and to have to try to be strong and not cry in front of them. Adios, papi. Adios. That is the hardest thing to do because you're supposed to be the strong one, right? But when it gets turned around, especially with children, to tell you it's okay, that's amazing. That is true love. That is love manifested.
It has a huge psychological effect. Feeling that they're supported, they have support for years to come. You're gonna see, I can't wait until next year when we come back to see these kids again as they grow and they become more functional and their outlook, in life is changing.
I promise you, with your donations, I'm able to help kids, and I am 100% committed to making sure that happens. And along the way, hopefully, the future generation of plastic surgeons are inspired to maybe give back when they get older in their careers. There's a lot of mentorship and a lot of impact that we can do within the surgical specialties. And I'm just so grateful for the opportunity. I can't thank you all my followers that follow me. I can't thank all the messages I get on social media. I really appreciate all of you. It means a lot to me getting all these messages. I woke up one morning, I had like 30 messages, and I'm just tickled, and I'm just so grateful for your support and your love. It makes a big difference for me, and it's gonna keep me going. It just adds more fire and more ambition in me to get better and help more children next year. So thank you again, and stay tuned for next year.
Up to the sky and down again, around the world and back again. That's how proud I am of him. And my husband is just as proud.